Hey, welcome back. In this section, this is the first of two parts where we are going to be learning about blood vessels, the chest, and they extend into the neck. So basically think chest and neck area. And in this particular video, we are going to be looking at the arteries in that area. So talking about arterial blood flow, we always start at the heart and work our way away from the heart because that's the direction of blood flow. So we are going to start with the aorta, which is quite a large structure and has areas of it. So from this point on, don't just be using that word aorta. You need to be talking about a specific area of the aorta. So the first part of the aorta goes in an upward direction. So it is called the ascending aorta, highlighted in a bright pink right here. The next section is called the arch of the aorta because it's curving and it's going in a posterior direction, as you can see from the far left picture. This is the heart here and this red blob. There's the ascending aorta, and now it's curving to the left and posteriorly. And in the aortic arch, you can clearly see that there are three huge blood vessels that come off the arch of the aorta, which we will be talking about. After the arch, the aorta is going to descend for the rest of its pathway, but using the word descending aorta is not a good choice. And so I need you to use the word thoracic aorta if we are in the thorax. And then when we're in the abdomen, we're going to use the word abdominal aorta. Otherwise, nobody has a clue where you are along the 3-foot pathway. So let's go back to the arch of the aorta and those three branches. The first branch is called the brachycephalic trunk. Okay. So the aorta, as I said, is arterial blood, but it's not called the aorta artery. It's just called the aorta, ascending aorta, arch of the aorta. And for blood vessels, you need to put on all the other blood vessels those modifiers, those words artery or vein. Now, some arteries are main arteries very close to the aorta, which are going to almost immediately branch. And for those, instead of using the word artery, we use the word trunk. Okay, so for instance, when you learned about the heart and you learned about the pulmonary trunk, it bifurcated into the right pulmonary artery and the left pulmonary artery. So this is the brachycephalic trunk. And the name is telling you what the two branches are going to be doing. Brachio is brachium. So it's going to have a branch that's going to go to the upper extremity, and cephalic means head. So the other branch is going to be going towards the head. So the branch going to the head, the main branch going in the neck from the chest and traveling up in the neck is called the common carotid artery. Now, a lot of students misspell that word carotid, so just remember it starts with that word that means automobile, C-A-R. It's not C-O-R-A, it's C-A-R, carotid, the common carotid artery. And then the common carotid artery coming up is going to split into two. And one branch is going to stay outside the skull, and one branch is going to go inside the skull. So if you were seeing a branch like this, it would be very easy to see that these would be going internal and these would be staying external. However, it doesn't branch like this, it branches like this, okay? And so for this, I want you to stop and think for a second. Have you ever seen like somebody who's really mad and you see that little pulsating here in their temple area? Okay. Is that little pulsating thing anterior to their ear or posterior to the ear? That's anterior to the ear. And is that inside the skull or outside the skull? That's outside the skull. So that tells you when it's branching like this, the anterior to the ear, the anterior branch is going to be the external branch, okay? So I'll get to that in just a second. Going back and looking at the arch of the aorta on the far left picture, we have the brachycephalic trunk, and coming off the brachycephalic trunk, we're going to have one branch going towards the other upper extremity, and the other branch highlighted in blue right here, that is the right common carotid artery. So the right common carotid artery is one of the two branches of the brachiocephalic trunk. And so on the far right picture, this is the brachiocephalic trunk I'm pointing to. You can see the brachiocephalic trunk right here coming out from behind that blue blood vessel. And then this is the branch going to the upper extremity, and with the yellow arrow, that is the right common carotid artery. So now you're asking, where's the left common carotid artery? Well, the left common carotid artery is the second branch that comes off the arch of the aorta. So it comes directly off the arch of the aorta. And then we'll travel up in the neck on the left side, as you can see highlighted in blue. And the far left, all of that is going to be left common carotid artery. And then just superior to it, you can see the two branches for the internal and external carotid artery. So if you go back to the question about the pulsating arteries being anterior to the ear, and we have our two branches like this. Now turn your head sideways. This is the external branch, so it can go up here. This is the internal branch. And so that is the same. All of these are now doing the same view I just showed you. So doing the far left one, because I actually think the picture is easiest on the cadaver. This is the common carotid artery coming up in the neck. You can see the bifurcation. So this one is going anterior to the ear. That's going to be your external carotid artery, which makes this one the internal carotid artery, which then dives through the carotid canal to reappear as part of the circle of Willis that we've already learned about. Okay, so pause it if you need to look at all these pictures. Common carotid artery, and this is the external carotid artery, and right there you actually can see it diving into the carotid canal. So if that's the internal carotid artery, then this is the external carotid artery. And as you can see on the far right picture, as well as the cadaver picture, but it might be easier to see on the far right picture, the external carotid artery is going to go up towards the head. It's going to have branches which supply the face, and there is the end of it giving the pulsation. That's not called the external carotid artery when it's in the temple anymore. All right. Going back to the arch of the aorta, the third blood vessel coming off is called the left subclavian artery, and it's called that because it goes just deep to the clavicle before it dives into the armpit area. So you can see it right here. The clavicle would sit right in this area right there. So that's the left subclavian artery. Where's the right subclavian artery? Well, it was that other branch of the brachiocephalic trunk. So to recap, when we were looking at the arch of the aorta, we had three blood vessels that went to four places. The first blood vessel, the brachiocephalic trunk, went to both the head and the neck on the right side. The second branch went to the head on the left side, and the third branch went to the upper extremity on the left side. So looking at your branches, the first branch is the brachiocephalic trunk. The second branch is the left common carotid artery. The third branch is the left subclavian artery. And although not shown here, the brachycephalic trunk bifurcated into a right subclavian artery, which comes in this direction, and a right common carotid artery, which continues superiorly on the side of the neck. So here is that right common carotid artery. I know it's the right because it's showing the right side. There's the right common carotid artery. Posteriorly, we have the internal carotid artery, which dives inside the skull. And then anteriorly, we have the external carotid artery, which is giving like a facial artery to the face. And then that pulsating blood vessel right here, the superficial temporal artery. And That's it for arterial blood flow, and I will continue with a separate slide for the venous blood flow.